Doug, thanks very much for joining us. One of the big catalysts for so many industries over the last couple of years has been the pandemic. And I'm wondering, although, it was obviously a health problem, it doesn't necessarily affect drug pricing so much that I can see off the top. But has COVID changed the way your business works?
It really has, Matt, and thanks for having me. For a lot of people, they simply just couldn't get to the doctor. I believe in the U.S. there were over 1 billion undiagnosed conditions where consumers simply couldn't get to the doctor. And I think that really turbocharged telehealth. And also for many Americans, they simply couldn't get to the pharmacy. And so they were looking for alternatives, whether they be, mail order, which actually didn't rise much, but at least people were open to it for certain medications. And of course, really mostly trying to improve access to doctors. And so, GoodRx has a telemedicine service that really blew up over the course of the pandemic. And we're proud to continue to roll that out and continue to treat more conditions, as the pandemic recedes, actually.
I could see how televisits would lower costs substantially for everybody in the industry. But in terms of the price of the actual pills that I need to get at the end of the day, it doesn't seem like it would make a dent in it. Mail order makes more sense to me in terms of lowering pricing. What do you see on the cusp of changing prices for drugs?
Yeah, I don't think the pandemic actually impacted the cost of drugs very much, although it did impact people's insurance coverage and people's ability to afford prescriptions and afford medical care. And so if you lost your job, for example, like millions of Americans did, you suddenly were paying the full price of drugs, which, as you know, is an incredibly high number. I mean, it can be hundreds of dollars for something that should cost $5. And so I think, where GoodRx really exploded over the course of the pandemic, and really since our establishment 10 years ago, is as people had some sort of coverage change, or honestly, their insurance just pulled back on them, and they were left holding the bag for incredibly expensive both drugs and now healthcare too, where we can help out. And so that's really where we play, is in the either a disruption or a consumer who has insurance. 3/4 of the people that use GoodRx actually have insurance, and yet are finding these huge gaps in care and just simply need help. So that's really what we do.
What kind of growth have you seen during the pandemic? I mean, you made some acquisitions, Hey Doctor for one, that really get you into the faster growing side of the business, right?
Sure. I mean, in Q2, we had record profit, record revenue, and record users. Over 20 million people a month now use GoodRx. We have an accumulative $30 billion in savings, and we're really seeing growth in all segments. I mean, we're especially having growth in our brand savings opportunities, where 19 of the top 20 drug manufacturers now partner with GoodRx to educate consumers. And also, again, we just launched GoodRx Health, which is an educational resource with tons of information written by America's best doctors and pharmacists. So we're really trying to get into helping consumers throughout the healthcare journey. So we're really just pushing on all cylinders, because Americans have never needed help more than now. And as the COVID pandemic recedes, we're stuck with the other, huge problem in this country, which is just unaffordable, unattainable care for people. And I'm so excited to continue to go after that.
Are people continuing to use telehealth? Are people continuing to, zoom in to doctors, so to speak, even as we see lockdowns lifted?
I think telehealth kind of exploded over the course of the pandemic. So like for primary care, that was the only option for many months for most Americans. I think what we're seeing now is some receding of the telehealth momentum, where consumers are going back to physical doctors. They do like seeing doctors in person. I think for certain conditions, we've seen a permanent change. Example, mental health care, right? Where I can see a therapist over Zoom. I think that's a perfectly good experience. I think some care management stuff, you're seeing a lot of more permanent moves to telehealth. But I also think consumers really enjoy the in-person doctor experience when they can get to that doctor. And the average wait in America is 29 days to see a primary care physician. And so we think that telehealth will have a larger role, certainly than pre-pandemic, but I do think that wave to some extent is receding. People do like to see providers and have a consistent relationship with their provider in person when possible. So some change, but not all change.
Doug, let me finally ask you about pricing. From here in Germany, we never pay very much for the actual drugs that we get. I think the state makes sure of that, and the same is true across Europe. I sometimes feel like Americans are subsidizing pills for the rest of the world, paying such exorbitant prices. How could that possibly ever change?
You know, we're going to need like wholesale change to actually fix the pricing mess that is this country, right? I mean, I've got in my bag right now a drug that's $5,000 that probably costs maybe $5 in Germany, right? We just have this system that is inherently broken. And the problem is that the people that pay the price are literally the end consumers who then choose in this country to simply not pick up the drug. And of course, when they don't pick up the drug, they end up in the emergency room, et cetera, and the downstream costs are so great. And so, you know, look, we've got a whole host of changes. I think consumers need to change their behavior and do more homework. I think we have legislative changes that need to happen, and you know, I think industry as well needs to be more upcoming with more information so consumers can make those choices. And so, look, we're going to be there to connect all those constituents to ultimately just find the best prices and convenience for consumers so they can afford the health care they deserve.